Hi, I'm Fallyn Dionisopoulos. This summer, I was a nursing intern at South Point Hospital for the anticoagulation. My mentor was Tammy Chesser. The title of my project is How Long Does It Take a Female Patient's INR to Become in Range After Coming to a Nurse-Based Anticoagulation Clinic? The purpose of this project is to find out the length of time it takes each new patient to become in range after coming to the clinic, and to determine the age group and gender that is more likely to be in range, and those patients who are out of range to determine if it's due to them missing their appointments. This matters because it can show patients that if they miss appointments, they will have a more difficult time trying to stay in their INR target range. Coumadin is an anticoagulant medicine. It is used to lower the chance of blood clots forming in your body. But blood clots can cause a stroke, heart attack, or other serious conditions such as clots in the legs or lungs. This medicine must be monitored because it's a very dangerous medicine. Coumadin blocks the formation of clotting factors in the liver that are dependent on the vitamin K. Therefore, it prevents clots from forming. The thought for this project is to see how long it takes each patient to become in range after coming to the clinic, to see if patients are out of range because they are not compliant, and to determine who is more likely to be in range. To answer these questions, the MyPractice database was utilized. The evaluation of female results were the focus of this project. Before beginning the research, it was speculated that patients near or at retirement age, especially women, and married men are more conscientious of their Coumadin treatment. Therefore, these patients are more likely to become in range quicker than patients of non-retirement age, especially males of a single marital status. The methodology for this project was first to retrospectively review the chart for each new patient who was new to the anticoagulation support clinic in the year 2010. Then, using the EPIC system, review each appointment following the first visit for 6 months. The patients were then divided into categories as gender, age, and marital status, and there were many different factors determined to see what could relate to them being out of range. And the project was conducted until each patient was reviewed and the sheet with the patient's name was destroyed. This is my abstract. These are charts. This one is for how many days it took each patient to get in range, divided into their age and marital status. And these are the patients who never reached range. These are the patients who either discontinued taking Coumadin or discontinued coming to the anticoagulation support clinic. These are the percentages of patients who were in range at their first visit, and of those patients who were still in range 1 month later. And then these are the ones who took more than 14 days to reach their target range and 14 days or less to reach their target range. The charts show that it kind of varied with who did the best of which age group, and it took an average of 20.05 days for females to reach their range as a whole. This is the 20 to 30-year-old female analysis, 31 to 40, 41 to 50, 51 to 60, 61 to 70, 71 to 80, 81 to 90, and 91 to 100. This project showed that most patients who were out of range was due to them missing their appointments. The project showed that patients who miss appointments are more likely to be out of range, and that patients who are of retirement age, which was 61 for this project, were not more likely to be in range than those who are of non-retirement age. This information can be helpful to the nurses of the anticoagulation clinic to know which patients are more likely to be in range, and then the nurses can predetermine that patients will be out of range if they miss consecutive appointments. It can also help the patients by showing them how the other patients in their category do and hopefully encourage the patients to stay in range. This project could be improved by conducting the study among more patients to obtain more accurate results. The receptionist could call patients the day before their appointment to help them remember to come. And the nurses can stress how important it is to each patient that they come to each appointment. It is recommended that there is a reminder called that a secretary calls to remind the patients to come so they don't forget their date or time, and a sheet could be added to the teaching information to explain to patients how much easier it would be to stay in their target range if they come to each appointment. Thank you to my mentor, Tammy Chesser, the anticoagulation nurses, Linda Pasick, Carol Weber, South Point Hospital, Cleveland Clinic, Office of Civic Education, and thanks for the opportunity to present my project.